Let's begin. I would like to show you today presentation about differences between primary and permanent teeth and dentition. Our learning outcomes. First of all, general features, then morphological differences, crown morphology, root morphology, pulp chamber differences, root canals, and histological features, enamel, dentine, and pulp. So what about general features? As we know, all human teeth are divided into deciduous teeth and permanent teeth. And what features in different characteristics? First of all, quantity. In temporary bite period, there are present 20 teeth with 5 teeth in each quadrant, with 5 teeth in each quadrant. Fifth, sixth, seventh, and eighth quadrants. Instead of permanent teeth, total quantity is 32 teeth with 8 ones in each quadrant. First, second, third, and fourth quadrants. Next characteristic, teeth types. In temporary bite period, in temporary dentition, the present next teeth types: central incisor, lateral incisor, canine, and first and second molars. So, central incisors, lateral incisors, canines, first temporary molars and second temporary molars. The same situation in the lower jaw: central incisors, lateral incisors, canines, first temporary molars and second temporary molars. Instead of permanent teeth, has similar and different groups of teeth: central incisors, lateral incisors, canines, first premolar, second premolar, first molar, second molar, and third molar in the upper dental row. And similarly, central lateral incisors, canines, first premolars, second premolars, first molar, second molar, and third molars. Next characteristic. Dental formula of temporary teeth. Incisors. 4 incisors in upper and lower jaw. Canine, 2 canines in upper dental row and 2 canines in lower dental row. Molars, 4 molars in upper dental row and 4 molars in lower dental row. Total amount: 10 teeth in the upper jaw and 10 teeth in the lower jaw. Total 20 teeth. In permanent teeth, similar quantity incisors, 4 and 4 canines, 2 and 2, but the at premolar group. 4 premolars in the upper jaw and 4 premolars in the lower jaw. And 6 molars, instead of 4 molars in temporal teeth, 6 molars in upper jaw and lower jaw. In that way, 16 teeth in the upper jaw and 16 teeth in the lower jaw, total amount 32 teeth. Size, next characteristic, size. Temporal teeth are small except molars, and correlation between dimensions. Temporal teeth are larger than permanent counterparts. Permanent teeth, large except premolar, smaller than deciduous counterparts, for example, molars. Next characteristic, color. Temporal teeth are bluish white, also called as milk teeth, as its refractive index is same as milk. Do you understand why temporal teeth are called milk teeth? Not because child eat milk, but because refractive index in temporal teeth is same as milk. And permanent teeth are yellowish white or gray or brown in comparison with temporary teeth. Please look here. Tell me, please, doctors, what bite period are shown on this picture? Yes, you are right. Excellent. Why mixed? Could you explain me?
Incisors are prevalent and most operatives are primary. And also lower incisors are prevalent.
Why made you decision that upper central incisors are permanent? Why? You are right. Central incisors are yellowish instead of lateral incisors are temporary. I especially found this picture when permanent and temporal teeth are neighbor, to show you differences between color. So, placement in jaw. Temporal teeth are perpendicular in relation to the jaws. instead of permanent teeth are oblique in relation to the jaw. The long axis of permanent teeth is more vertical. Long axis of, temporary teeth is more vertical. Instead of a long axis of permanent teeth is more oblique. Eruption. Temporal teeth eruption begins at 6 months and completed by 30 months of age. Instead of permanent teeth eruption begins at 6 years of age and completed by 25 years of age. As can you see, begins at 6 months and completed by 30 months, near 2.5 years old. But permanent teeth eruption begins at 6 years old age and finish till 25 years. Very important characteristic is root completion. Temporary teeth roots are fully formed after 1 year of eruption of the particular tooth. Instead of permanent teeth root completion, takes about 3 years after eruption. You can see this diagram, and as can you see, a full process of root formation in temporary teeth take 1 year after eruption. In permanent teeth, 3 years after eruption. Then, shedding. Shedding of temporary teeth starts at 6 years and continue up to 10 years of age. And shedding of permanent teeth don't endeavor, but can be lost due to any pathologic resorption. And now let's talk about features of different parts of the teeth. Let's begin from upper part, crown, and crown morphology. Shape of crown of temporary teeth is more bulbous. Instead of permanent teeth, less bulbous. Dimensions. What teeth are bigger and what teeth are smaller? Tell me, please. Permanent or temporary? Yes, you're right. But absolutely bigger. If we will compare width and length, we need to mention that temporal teeth are wider mesiodistally in comparison with their crown length. In other words, the temporal teeth are wider than longer. Instead of permanent teeth, are narrower mesiodistally in comparison with their crown length. In other words, permanent teeth are longer than narrow. Like in this scheme, temporal teeth are wider mesiodistally in comparison with their crown length. Instead of permanent teeth are narrower mesiodistally in comparison with their crown length. What about surface? Anterior surface or labial buccal surface, flat molars, palatal or lingual flat. Instead of permanent teeth are convex. Let's see this picture. Temporal teeth have a flat labial or vestibular or buccal surface. Instead of permanent teeth are convex, not flat. Let's continue about crown morphology. Mamelons. In temporal teeth, mamelons are absent. In permanent teeth, mamelons are present. Let's look at this picture. In temporal teeth, mamelons are absent. In permanent teeth, mamelons are present. And vital photos. As can you see, they are shown flat incisor edges in temporal teeth instead of mamelons in permanent incisors. Cingulum. In temporal teeth, cingulum more prominent and occupies 1/3 of the crown length. In permanent teeth, cingulum is less prominent. Do you mention what does it mean, cingulum? It is cervical area of oral surface. In temporal teeth, cingulum is more prominent and occupies 1/3 of the crown length. Instead of in permanent teeth, less prominent and occupy less than 1/3 crown length. Then, cusp. Temporary teeth cusps are short, sharp, and pointed. Instead of permanent teeth cusps are less sharp. Schematically, short, sharp, and pointed cusps in temporary teeth instead of blunt cusps in permanent molars. Occlusal surface. Temporary teeth occlusal surface is shallow and shallow fissures. Permanent teeth occlusal surface is deeper, and occlusal premolars and molars have deep fissures. Look at these pictures. Shallow occlusal surface and shallow fissures in temporary molars instead of deeper occlusal surface and deep fissures in permanent buccal teeth, molars and premolars. And let's talk about what does it mean in practice. Features of fissures. It means that in temporary teeth we must perform procedure called pit and fissure sealing. Next characteristics. Occlusal area. In temporary teeth, the buccal and lingual palatal surfaces of the deciduous molars converge more occlusally. As a result, the occlusal area or occlusal table appears narrow buccolingually. Instead of permanent teeth, occlusal area converge occlusally, but not as much as seen in the deciduous molars. As a result, the occlusal area or occlusal table appears wider buccolingually. Let's look schematically. Narrow buccopalatal occlusal table in temporary molars instead of wide buccopalatal occlusal table in permanent molars. Please notice this term, occlusal table. This term is usable in all fields of dentistry: therapeutic, prosthetic dentistry, orthodontics, restorative dentistry, gnatology. So let's continue about crown morphology. Contact area or approximal surfaces. Temporary teeth have a small contact area placed more gingivally. Instead of permanent teeth, have large contact area, and they are placed either in the middle third or at the junction of the middle and incisal third. In area of equator crown part. Schematically, temporal teeth have small contact area in the gingival third, instead of permanent teeth have large contact area in the junction of middle and incisal third. What does it mean in practice? Features of contact area. In therapeutic dentistry, it means that to get nice restorations, nice composite restorations, we must use preformed special preformed metal matrices with special rings to get tight approximal contacts between restorations, step by step. And final result. They are shown position of contact areas in temporary teeth, and in permanent teeth and permanent restorations near middle part of crown height. Or area between middle and occlusal parts of thirds, crown thirds. X-ray and a vital photo. And multiple restorations in therapeutic dentistry. As can you see, a doctor used preformed metal matrices with special rings, and as a result, doctor created tight approximal contacts. As for me, the better than natural teeth were. But what does it mean in features of contact area position in prosthodontics? Our dental robot laboratory, and we, like doctors, need to create approximal contacts between our prosthodontic restorations, like artificial crowns or bridges. What about next characteristic of crown morphology, like cervical line? Temporary teeth cervical line is less curved. Instead of permanent teeth cervical line is more curved. Schematically, temporary teeth cervical line is mild curve instead of permanent teeth. Cervical line is more curved. Next characteristic of crown morphology is cervical ridge. The cervical third of the crown, cervical ridge of temporal teeth are prominent. Instead of permanent teeth, cervical ridge are less prominent. For temporary frontal teeth, the oral area for more prominent for temporary teeth and less prominent for permanent teeth. A very important characteristics: cervical constriction. In temporary teeth, cervical constriction is marked. In permanent teeth, less pronounced. So, schematically, marked cervical constriction in temporary teeth and less pronounced cervical constriction in permanent teeth. Let's go deeper from crown part to the root part of tooth. And let's compare characteristics of roots in temporary and permanent teeth. Length of roots in deciduous teeth, they are shorter and slender. In permanent teeth, longer and stronger. Schematically, temporary teeth have short and slender roots. Permanent teeth have long and strong roots. Crown root ratio. In temporal teeth, roots longer compared to the crown size. Comparatively, roots in temporal teeth are longer. But in temporal teeth, crown root ratio is different, and roots in permanent teeth are not as long as crown size. Schematically, in temporal teeth, roots are longer compared to the crown size, but ratio of crown root in temporal teeth not as long as crown size. Next root morphology characteristic: inclination. Inclination of roots in temporal teeth is slightly labial, as much as 10 degrees seen in the apical third of the frontal teeth roots. Permanent teeth don't show any labial inclination. What does it mean schematically? Temporary teeth root. Slight labial inclination of the root as much as 10 degrees seen in the apical third of the frontal teeth roots. Instead of permanent teeth, don't show any labial inclination. Next characteristic, level of forcation. In temporary teeth, level of forcation or dividing roots are near the cervix. Instead of in permanent teeth, the level of forcation of the root is about 3 or 4 mm from the cervix, or is more apically placed. Schematically, it looks like here. Point of forcation. In temporary teeth is near the cervix. Instead of point of forcation of permanent teeth roots is 3-4 mm from the cervix. Next characteristic of root morphology, root trunk. In temporal teeth, root trunk is not distinct, but in permanent teeth, trunk is long and distinct. Schematically, it looks like here. Not distinct. Trunk in temporary teeth instead of long and distinct trunk in temporal teeth. Next characteristic, root flare. Temporal teeth. Flare beyond the mesiodistal and buccolingual outline of the crown to allow space for development of the permanent tooth crown. But in permanent teeth, roots don't flare and are well within the boundaries of the crown. Schematically, it looks like here. Temporal teeth root flare beyond the mesiodistal and buccolingual outline of the crown to allow space for development of the permanent tooth crown. Instead of in permanent teeth, roots don't flare and are well within the boundaries of the crown. What does it mean practically? In surgical dentistry, please, doctors, don't forget that under temporal teeth and between temporal teeth roots are placed follicles of permanent teeth. And please don't forget main rule of pediatric surgical dentistry. Don't use elevator to extract temporary teeth. Don't use elevator to remove temporary teeth. To avoid permanent teeth follicles damaging or removing. Don't use elevator in pediatric surgical dentistry. And use only forceps. Only forceps. Let's go deeper inside of tooth. And let's talk about pulp morphology. Pulp chamber in temporal teeth is comparatively larger when compared with the size of crown. But in permanent teeth, pulp chamber is relatively small, not absolutely in millimeters, but relatively in compare with size of crown part. Pulp horn in temporal teeth. Pulp horn is extend more incisally or occlusally, and they are placed close to the enamel. Instead of permanent teeth, pulp horn not placed at a high level as in deciduous teeth. Schematically, it looks like here. In temporal teeth, pulp horn extend more incisally or occlusally, and they are placed close to the enamel. Instead of permanent teeth, not placed at a high level as in deciduous teeth. I'm sorry. What does it mean in practice? Size of pulp chamber. In therapeutic dentistry, in a stage diagnosis, diagnosis deep caries in temporal teeth is incorrect. Please don't make diagnosis deep caries in temporal teeth. Please don't be not qualified doctors. Diagnosis deep caries in temporal teeth is wrong. And I would like to show you this table with diagnosis about caries and compare temporary and permanent teeth. Diagnosis initial caries is correct for temporary and permanent teeth. Superficial caries. We can make this diagnosis in temporary and permanent teeth. Diagnosis moderate caries will be correct for temporary teeth and for permanent teeth. What about deep caries diagnosis, doctors? Could you help me? For temporalities, for permanent this diagnosis will be correct, but for temporalities, diagnosis deep caries will be wrong. But what about deep complicated caries? Could you help me? Can we make diagnosis deep complicated caries for temporalities? Yes or not? You are wrong. What does it mean, deep complicated caries? Deep complicated caries, it means pulpitis or periodontitis. And temporalities can have deep complicated caries like pulpitis and periodontitis. And of course, permanentis can have diagnosis deep complicated caries. So in a stage of caries management, practically, pulp chamber features. We need use methods for deep caries treatment. And please remember it that they are not used methods for deep caries treatment in temporary teeth. Next characteristic, root canals. In temporary teeth, root canals are wider and tortuous, instead of in permanent teeth, root canals are narrow. So, schematically, wider and tortuous root canals in temporary teeth and narrow root canals in permanent teeth. Next morphological feature, accessory root canals. In temporary teeth, accessory root canals more in number and situated in furcation area, instead of in permanent teeth, accessory root canals are present mainly in apical region. Next characteristics, root dentine and cementum thickness. In temporary teeth, root dentine and cementum are thinner. In permanent teeth, root dentine and cementum are thicker. Next very important feature, apical foramen. In temporary teeth, apical foramen is larger. In permanent teeth, narrow and constricted. What does it mean in practice? In therapeutic dentistry, in complicated caries management. Let's mention again, complicated caries, it means pulpitis and periodontitis. It is a clinical situation when we need to treat root canals. What about management of root canals? Let's go step by step. Endophiles, root canal files. For temporary teeth, we must choose bigger sizes. For permanent teeth, smaller sizes. Bigger sizes for temporary teeth and smaller sizes for permanent teeth. Could you tell me, doctors, what size number they are shown on this picture? Red mark, it can be or 25 size number 25, or next step 15. But what size? White color, it means or 15, number 15. Or 45. They are shown size number 15. Ultrasound methods of root canal treatment. We must use more careful this method in temporary complicated caries treatment, but standard use in case of permanent root canal treatment. They are shown ultrasound device from Mega company. I use this device many years with great pleasure. And root canal irrigation. You must choose bigger irrigation needle size for temporary teeth root canal treatment and smaller irrigation needles size for permanent teeth root canal treatment. They are shown bigger size, smaller and bigger size. Please mention that yellow color is smaller than gray color. Everything and everywhere. What about accessory root canals? Let's repeat. More in number and situated in furcation area. Accessory root canals are more in number and situated in furcation area. Instead of in permanent teeth, accessory root canals are present mainly in apical region. What does it mean in practice? In therapeutic dentistry clinics, complicated caries management. For high quality root canal treatment, the use of microscope is necessary. As can you see, they are shown upper first permanent molar with 5 root canals. What about root dentine and cementum thickness? Let's repeat. In temporal it is thinner, in permanent it is thicker. They're schematically shown thinner thickness in root canal, cementum and dentine in temporal teeth and thicker in permanent teeth. What does it mean in practice? In therapeutic dentistry, less aggressive methods and instruments should be used to treat root canals of temporary teeth to prevent root perforation. Let's repeat about apical foramen. Large apical foramen in temporary teeth and narrow and constricted apical foramen in permanent teeth. Large apical foramen in temporary teeth schematically and narrow in permanent teeth. What does it mean in practice? In therapeutic dentistry clinics, first of all, we must remember about this feature in a stage of making diagnosis. Why? As can you see, this patient has swelling on a right cheek. What primary diagnosis could you make? Doctors. Don't sleep. Please wake up. If we see adult patient with swallow cheek, what is the most widespread diagnosis? Complicated caries. And more precise diagnosis? No. Apical periodontitis. Acute apical periodontitis or acuteness apical periodontitis. Acute or acutal apical periodontitis. But, and of course, after opening of root canal, we will get a drop of pus, or maybe not drop, maybe more. But if our patient is child and if you are high qualified doctors, what primary diagnosis could we make? Let's work together. We can see swelling, we can see hyperemia, redness. Please, be brave. Yes, you are right. It is complicated caries. But we know that complicated caries, it is pulpitis or periodontitis. Yeah? Pulpitis or apical periodontitis has this child. Please, your options. You are right, doctors. I never ask you so simple questions. Temporary teeth have wide apical foramen. I told you that one of many features of temporary teeth is wide apical foramen. And what does it mean? It means that in case of pulpitis, inflammation very easy spread outside of root canal through apical foramen. And child with pulpitis very often will have appearance like here.